Let's move right away to a presentation by Mr. Tampi Koshi, who is advisor to the technical unit of the National Health Authority of India. We're very pleased to have such a senior expert with us today, who is going to talk to us about India's COWIN, right, as a comprehensive solution for vaccination. So it's, and maybe Mr. Koshi, you can also tell us how that maybe relates to some of the tools that WHO presented a little bit a few minutes ago. Thank you very much, Mr. Koshi.
Thank you, and good morning, good afternoon, and good evening to all of you present in the session. It is really an important session because the way the vaccination is proceeding in various parts of the world requires that there is a common understanding and a common set of standards and tools available across the world. I'm happy to present to you, I'm really excited to present to you a case study from India, which I would claim, because of the very sheer size of the country and population, is today the largest vaccination program happening in a short period of time. In the last 9 months, since we started in January 15th, we have managed to vaccinate and issue a digitally verifiable certificate to 750 vaccinations, out of which only 170 are dose 2, which means that we still have a long way to go with respect to completion of both the vaccination for our populace. But still, on an average, we are doing more than 7 million vaccinations in a day, and on peak days, we manage about 10 million plus in many of the days. So if I just quickly give you a way how we have gone about implementing this digital solution for a massive country like India, if you look at the whole digital requirement for vaccine management, there are broadly, two significant components. First one is what I've highlighted in blue, which is this is about managing the supply chain, the vaccine from the manufacturer to the delivery center. So I will say in this system, the hero is the vaccine. So we need to make sure that the vaccine produced at the manufacturers finally reach the last center, and we need to track this whole supply chain. And this is a system that we had introduced about 5-7 years in India for our universal immunization program, which we decided to continue using that for our current COVID requirement. However, there is a second part, which is where the hero is the beneficiary, the person who needs to be vaccinated. Here, we need to have a facility for him to be onboarded, registered. We need for the vaccination center to plan their vaccinations, their sessions, and when the beneficiary comes, we need to verify him, give him vaccination, and then issue him a certificate. So this is what I've done in the second part, which is highlighted in the orange form, the whole workflow, and that is a COWIN system that we developed in the last few months of 2020, and which started operating in January this year. So what was our guiding principle when we looked? I was just listening to Garrett and Madam Soumya when they highlighted that when we are considering implementing a system, there are some very basic guiding principle it is better to take into consideration. One is the most important thing is equitable and inclusive. For a country like India, where there are more than 22 languages, that is almost 32 states or union territories, each of them having different health administration system. When we try to create a national integrated solution, it is important that there is nobody is left out, and there is no disadvantage to any party or advantage to any particular party because of the basic design of the system. So that has been the most fundamental requirement that we kept in mind. I'll explain a little later how we have addressed this issue. The second thing is that there should be a single source of truth. We cannot have a situation where the whole issue of whether a person got vaccinated, how many people got vaccinated, what vaccination has been given, when it was given, all those things, if it is all dispersed across multiple databases which are not well mapped and connected, it becomes, you know, a humongous problem for the citizen because of his ability to prove or even track or prove, and for the administrators to see how it is going. So that itself is the second thing that we kept in mind. The third thing is the evolvability and scalability. When we started building, we knew we were aware that there is a possibility there will be more vaccinations, more vaccines coming. Each of them may have their own regime. Some of them may 2 doses, some of them may 1 dose. And possibly, we don't know yet that there could be booster doses coming. We don't know. So it means that the system designed should be able to evolve to take into this changing requirement with very limited notification, preferably configuration. So that was the next item. And the next point was the scalability. And we knew that in the early stages, we had difficulty in availability of vaccine, and then the vaccine supply goes up. And when there's a demand goes up, we have to scale it up really, really fast. So the architecture has to provide for the scalability. Today, we are happy to see that on peak days, we are able to do more than 10 million. And even if it goes to 15 million, I'm sure that our system will be able to handle it. And the third thing is, in all these things, there should be a mechanism for some amount of feedback, which can be aggregated as a means to, you know, provide update and on our systems and improve the processes. So if I just give you a broad base, I'm not going too much into technicality. Later, if there is a question, my colleague Rajesh Menon is also there in the panel with me. He is very closely associated with the technical technical development, as well as he deals with the international agencies to draw input from them in shaping our standards, as well as provide input from our side what we have done. So any questions, we'll go in detail, but I'm giving the the big picture view of the architecture. On front side, you can see the CoWIN portal, which is where the various parties will access either it is citizen, or it is the vaccinator, or it is the policymaker, or it's the administrator. So behind that, there are broadly 4 modules. One is registration and scheduling module. This is all about the beneficiary. So we need for the beneficiary to be onboarded. We need beneficiary to be made available on the various vaccination slot. We need him to book his vaccination slot, and all those things about coming in and onboarding himself for vaccination 1 and dose 1 and dose 2 and so on and so forth. The next one is the vaccination facility module. This is a module for the facility to sort of plan and manage their vaccination, including the number of doses available, the daily planning and weekly planning, and so on and so forth. And then the third is the vaccination module, which is the workflow. The workflow of each beneficiary coming in, identity being verified, goes through the process of obtaining his vaccination, confirming that his vaccination had been completed, and then he's issued digitally verifiable certificate immediately. So this is broadly the architecture, but it is a highly, and we have provided significant extensibility to make sure that this is, the usage can be as broad-based as possible. So on the right side, what you will see is that while the beneficiary will receive a certificate immediately upon leaving in a physical form, he can also get a digital PDF form with a digitally verifiable QR code embedded in it. And the QR code is digitally signed by the issuing authority, with the Ministry of Health and Family Welfare. And this one can be ingested into many third-party applications. Already in India, we have 3 third-party applications. One is what we call the Umang, and the other is Arogya Setu, which is like a contract tracing application. And then there is a DigiLocker. So, or even there are any other third-party applications who would like to ingest this one. The certificate is made available in a JSON, which can be ingested into any third-party applications. So that way, the availability is very, very broad-based. It could be on the computer, it could be on the mobile phone, it could be on a paper form, it could be in third-party application, and so on. So that is on the extensibility that you see on the right side. In the left side, we have also provided some interesting API extensibility. One is that, of course, that we have provided interface with the AFS system, so that the whole workflow of any adverse effect tracking is also form a part of the larger system that we have, and those information sort of seamlessly flow. And the other thing that we have done is that we have provided API integration for third-party systems. two kinds of things. There are some, digital players who have brought out with many interesting apps to help people to look at what are the kind of schedules available, what are the slots available, book for the slots, and all those things in a, with a lot of more user-friendly mechanisms. So those kind of third-party applications are available. And the other side, some of the hospitals, etc., have their own administration system. So that also is given a seamless integration with the CoWIN portal with two objectives in mind. One is that they should also declare their slots and made available to a larger audience to help people to reach across, not limit to a very, very small location or to only the people who go and log into that hospital website or so on and so forth. And the other side, this data should be in synchronous so that anybody can book in the central system also will get connected to this hospital system seamlessly immediately to enable him to book his vaccination slot and vice versa. Thirdly, is that we are taking a national policy that certificate issuance will be centrally managed. Only there will be one issuing authority. So independent of which hospital or center is administering the vaccination, their system will talk to the CoWIN and use the vaccination module, which is an open source module available. I'll discuss that about a little later, and which is drawing from one of the open source reference, WHO compliant software, which has been referred in the earlier slide too, called DIVOC. So the certificate module draws from there. So that's how the whole thing is integrated together. So if I quickly look at what are the kind of the features for citizens, one is the blended registration. So, a point, earlier speakers has alluded to is about it in no way just because it is digitally available, it should deny anybody the opportunity to come and get the vaccination or restriction, limit any kind of limitation. So there we have taken some very, very strongly. One is somebody can log in, somebody can access a website or an app and digitally look at the slots and book for one. Then we have made sure that every hospital facilities had been requested to provide certain number of their vaccination slot purely for walk-in. And based on the locations where vaccination facilities are there, the local health administration will ensure that the walk-in facilities are given, and that means they can register at that center itself. So which means that while they may not, the beneficiary may not have the digital access, but the whole registration and the vaccine administration is managed digitally. The third thing that we have also provided for call centers and IVRs and CSC, Citizen Service Center, etc., where the citizens can access who do not have a digital connectivity and can get an equal opportunity to book himself a slot like anybody else. And it is because of this kind of special attention that we found that even in the most backward districts in India, when about a few weeks ago, I remember we had done an analysis that the per capita vaccination in even the most most backward districts have been almost the same as, or some places even better than the national average. So it provided variety of mechanism for slot booking, and then it also provided for tracking of vaccination schedules. It could be available online. We still send SMS reminders, the local, and you can check that with the call centers and so on and so forth. And the most important is instant digital certificate printed with a digitally signed QR code, which is very viable anywhere in the world. And then vaccine features for the vaccinators and administrators include, one is, of course, the stock management at each of the units. That means the vaccinator, the CoWIN module allow for each of the facilities to for the data to be ingested into the available the new stocks coming in. Then based on the CoWIN usage, how the stocks are depleted, how is the management happening, what's the kind of availability daily, weekly, monthly, and based on that, how do you do the sessions planning and so on and so forth is part of the feature is being given, which is there in today. This is being used in more than 100,000 vaccination centers across the country. And some days there will be more, some days there will be less, but the scaling up had been enormously comfortable, which is available on mobile and local normal computers and so on and so forth. And in a short period of time, if they have digital not connectivity, those centers can even work offline. Later, there's data naturally gets synced between each other. Then it also provides for real-time dashboards for the policymakers and administrators at various level. It could be at the vaccinated level or at the district level, or it could be the state level or the center level. So all those things which are properly integrated and aggregated from a purely for a data-enabled decision support, at the same time taking enormous care to make sure that the privacy and security of the data is taken care. Of course, the policymakers, the first thing, as I said, is the inclusivity, to make sure that there are multiple modes of access without anybody being in any fashion restricted to make available, make use of this facility. Then based on the way that is, the vaccination is proceeding, since the data is really real-time available, it helps the policymakers to continuously evaluate geographical disparity, what are the areas, and also helping the local administration to take up initiative with respect to special campaigns where things are going slow, where there is sufficiency, where there is issue of sufficiency of vaccines and so on and so forth. I'm not saying that this is, it's like a most perfect and everything is hunky-dory. We of course recognize there will be problems, but the beauty is that there are two things. One is that it, this kind of an integrated system gives really immediate time the information to take a corrective action at to the best possible compared to any other means. And so that's the single source of truth becomes a key thing. And as told earlier, this also have a seamless integration with the adverse effects. So with all these things in the last, as I said, 9 months, we completed about 750 million vaccinations, out of which only 180 million is second dose. But we may do, for convenience and trackability, we issue a certificate for every dose. So the first dose is provisional certificate and second dose is final certificates. 180 million final certificate issued till date. And there is only one central issuing authority, which is the Ministry of Health and Family Welfare. So this certificate module, as I said earlier, is based on a globally recognized and WHO compliant software, open source software stack called DIVOC. And that is a foundational layer on which this certificate module is based on. And we are happy to see that there has been a better adoption of this across the world. And already a couple of countries, Philippines and Sri Lanka, has sort of gone live. And there are a few other South Asian and African countries are in various stages of evaluation and implementation, which I believe, especially, many of them are looking at this as, although they are looking at this as a means to provide travel documents to enable people to travel, travel with the proof that he has completed the vaccination. Although, as WHO very clearly said that, though the countries may not insist on a vaccination certificate, but it also helps in many of the other processes they would like to follow. So that is a way, so this is going forward. And another good thing that we are also trying to do is that we are using the same, the infrastructure, the architecture to provide the RT-PCR certificate, the test certificate. It is not launched yet. We are expecting it to be launched probably in a week's time. So there are again two advantages. One is it uses the same standards. It means that even internationally, for many other countries, it will become a very easy reference point of verification, and the utilities for verification will be common. And eventually, it also for the consumer, probably from the same, same portal, they should be able to get both the certificates and so on and so forth. So that's a way in which we are proceeding, and we expect that to be launched soon. So if I look at the basic design principle of the certificate, it is based on the W3C verifiable credential data model aligned with the WHO DBCC guidelines. Currently generates W3-based signed JSON documents for vaccination certificates, and it has the flexibility to generate signed FHIR DDC documents, based on the interim guidelines. And this we are making it as implementing it as a facility that for any third-party system who would like to have the FHIR compliant format, they will be able to make it available. And even in India, we are, even in our National Digital Health mission, FHIR is considered as the standard. So we expect that this will also help the the personal health records, which are getting popularized in our country, will be able to easily ingest these things, making this a part of the larger personal health record. And privacy preserving and authenticity verifiable by a digitally signed secure QR code. It is multi-distribution model, digitally available on smartphones, printable on non-smartphone. Let me just quickly run through. I know my time is coming out. See, if you look at the way it works, is the after the vaccination event is completed, data affects where the certificate module and the real-time generation of vaccination certificate happens. It is immediately available for download or printing. The next element, the critical thing that is also there, we have provided for the verification. It's a very, very important facility. We have provided an online facility for verification of the authenticity of this vaccination certificate, which can be this. It is available in our portal. Anywhere, any authority anywhere in the world can access this portal and scan the QR code using a normal camera and feel satisfied that this is a authentic certificate. In addition, we have given two more functionality. One is that we have published the public key.
Есть еще пара функций, которые я хочу осветить. Есть ключ, который мы опубликовали на сайте и предоставляем спецификации.
Public good, so that again third-party countries can use the specification, use this, the public key, and use it for their own verification mechanism without any compulsion of using the online facility that is anyway available globally. We have also provided another functionality, which is to make any changes. We recognize that when you do it at that scale, there could be some cases where there will be some few mistakes that could have happened. So we have created a very formal, structured, authenticated process for any verifications, any corrections. And this corrections at the time, if it becomes corrected and the old certificates get revoked and the new certificate gets generated with the new certificate ID. And that is, and there are all, we also realize that sometime, and in many of the cases when the people used, their ID, one of ID to prove their identity at the time of verification, at the time of vaccination, they had faced the, they may not have given the passport, and sometimes people, international travelers feel that, if they are given passport in the certificate, the details of the passport number, it will be very convenient. So from that point of view, we have even provided the updation facility for that. These are the major functionality that we have provided. So this is the big picture view I wanted to share on as a case study from what's happening here in India. Is one of the most ambitious vaccination program, including tracking all those vaccination in one integrated system and nationally recognized single issuing authority, giving confidence to every person who is verifying and for every verifying anywhere in the country or in the world. Thank you.
Thank you very much. I mean, I think it's a true performance to present such a system in less than 20 minutes or about 20 minutes. It's very impressive and very enlightening. I mean, it's not just the COVID certificate system. I mean, it's all the backend as well, all the vaccine tracking system. So very comprehensive. And what I heard from you is verifiable anywhere in the world, which is the type of thing that we are particularly interested in. And so maybe and then that some other countries are also using some part of the system, or at least have systems that are a little bit similar. So maybe you can elaborate on this a little bit later.